Hi, my name is Rachel Eisfelder. I'm an occupational therapist. I work with Veronica's Voice and Magdalene, KC. I want to talk to you a little bit today about mental health and those who've been sexually exploited. A very common experience among survivors is childhood sexual abuse. The average age this trauma occurs is between 9 and 14 years old. Due to this type of trauma, many people tend to start using drugs or alcohol at an early age. The average age for alcohol or drug abuse is 11 years old. 75% of our residents meet the federal definition for trafficking. Out of all of those women, they have experienced rape. They've experienced physical assault, often aggravated by weapons. And this is all while they have been trafficked or are being prostituted. All of the women that we work with have a diagnosis of post-traumatic stress disorder or PTSD. Most of them have a co-occurring illness. Approximately 65% of the women who have been sexually exploited have PTSD equivalent to those who've seen combat in the military. Unfortunately, because of their history, our survivors are not always seen as the victims. So there's a significant amount of stigma, more so than others with mental health disorders. Providing services for mental health is costly. We provide those services free of charge to the ladies we work with. We have a 2-year program, and survivors are provided with individual and group therapy services. These services are based out of best practices. We want to focus on addressing their trauma in the best way and most successful way possible. We provide cognitive behavioral therapy, dialectical behavioral therapy, all within a context of building skills so that individuals can learn healthy habits and routines and focus on healthy ways of communicating and managing themselves so that they can progress and recover not only in their mental health and with their addiction, but also recover their life. Licensed therapists, occupational therapy practitioners, we have nutritionists and peer counselors who assist in providing services during our programming. Each team member is educated on trauma-informed care and provide client-centered skills and client-centered practices for each individual at Magdalene, KC. Our focus is to provide skills needed for each person to have life recovery. We want to thank you for what you do to help support Veronica's Voice and Magdalene, KC, and would love you to be a part of changing the narrative for those who have been sexually exploited and receiving mental health care. Thank you so much for all you do for this organization and for the ladies that we provide services to.